Hey guys. So I felt obligated to make this video because I don't want what happened to me and my family to happen to you. So I'm just gonna get into it. My dad has Alzheimer's, and about a week and a half ago, he got really sick. In his memory care facility, the caregivers started noticing that his legs were like 5 times larger than normal, and he couldn't stand up anymore. Like, that's how swollen they were. They were like preventing his muscles from working. So they sent him to the emergency room, and obviously, I got a call from my mom. She's trying to hold back tears, and I just dart over. It's like an hour drive or something like that. And when we get there, we find my dad, and like, he is out of it. Like, he is gone. He is so gone that I thought they had drugged him. Turns out he just had, like, he didn't just have, but he had a really high fever, and it was high enough for him to just be completely burnt out. So after some time in the ER, we finally got a room for him in the hospital, and the doctor started to look into it and see what was going on. Now, what's crazy about all of this and is really frustrating is throughout this experience at this hospital, I got to see a side of the medical industry that I didn't even know existed. I've heard terrible things about nursing homes. I've heard terrible things about memory care facilities, horrifying stories, but I've never really heard a lot of bad things about hospitals. Obviously, you get like the couple one-offs, like the crazy nurse did this, the crazy doctor did that, right? Like someone was stealing bodies in the morgue. I mean, I don't know, whatever, right? But I don't want to call it laziness. What do you even, what? I don't even know what you would call this. It's so bad. The lack of willingness to try. I don't even know what you would label it. I mean, you guys let me know what you think. One of the first things that the doctor recommended before we even knew what was wrong with my dad, and just like, once again, background here, for those of you that don't know or do know, I don't even know if I said it in this video yet, but my dad has Alzheimer's, okay? Alzheimer's patients are not easy to deal with, pretty much no matter what. If you tell them no, they're gonna get angry. You keep telling them no, they're gonna get violent, and you're gonna have to like physically restrain them. It's just how it is. They don't understand why you're telling them no. They don't understand where they are. My dad is like one of the sweetest guys, one of the most loving people I've ever known. But even that, the disease doesn't care. It doesn't care how good of a person he was or is. So one of the first things they recommended was to put him on hospice. Literally right off the bat. It wasn't even a be prepared conversation. It was a recommendation. They're like, yeah, you should put him on a hospice. That's what we're looking at. That's what we're looking at doing. That's what we're thinking, what we recommend. And I'm sitting here like, dude, you don't even know what's wrong with this man, and you just want him to die? That was my first impression. I immediately knew that I couldn't trust anyone in that hospital. Like, I immediately knew my dad's name was just a name on the doorframe to these people. And I shouldn't say these people, like everyone, because we had some kick butt nurses. Like, we did. But I don't want to like lump everyone together. I had like one charge nurse that was just like top tier, dude. Like, she was, I don't know how many rooms that she went to, but I knew like she visited my dad like multiple times. And, I tried to like make good relationships with every nurse there. But like some nurses, you could tell like they would literally, they're just there to do their job and get home, But anyway, so from there, we obviously tell the doctor like, no, like, let's figure out what's wrong before we start going down that road. That doesn't really make sense to either of us. Like, we literally don't even know what's wrong with him. Why would we like just leave right now? Like, because we're like an inconvenience, like what, like this doesn't make sense. So Okay, they're like, okay, fine. You know, he's got a catheter hooked up. They start doing the blood cultures, like all this stuff. And then I'm like, okay, well, next point of issue is we don't know how long it's going to take my dad to recover. So, I mean, like I said, going into the hospital, I thought he was sedated, but he was so sick that he would only wake up for fragments of time. And I'm just, you know, I'm just trying to figure out what's going on, you know. But I'm anticipating like weeks of recovery, you know, like especially with someone with Alzheimer's, it's so hard to tell. But with that in mind, he needs to eat. For people who don't know, people that have Alzheimer's, it is incredibly hard to keep weight on them. My dad weighs 144 pounds. Before he got Alzheimer's, he weighed 205. The disease just rapidly, deteriorates your body. You burn crazy amounts of calories, sometimes for absolutely no reason at all. Even sometimes there is a reason. A lot of times, people with Alzheimer's, they walk all day long. Like my dad used to walk probably literally just like 2 weeks ago, 3 weeks ago, he walked maybe 5 or 6 miles a day. Some people say I'm over exaggerating, but like honestly, there's just no way. The man is standing and shuffling for, a solid like 8 to 12 hours. Like it's crazy. They have no concept of, they don't really understand being tired, you know? They just go. Anyone who has people in their family that have gone through this, like, you know what I'm saying. So anyway, I'm thinking in my head, like, okay, if he's going to be burning all these calories, if he's going to be wasting away, well, he's already having problems like standing up, walking around. He's had a couple fall issues this year since he's been in his memory care facility. And I'm telling them, like, we need to put a feeding tube in him. Like, I'm not stupid. If he burns, if he loses more weight and gets down into like the 130s or 125s by the time he leaves because he hasn't eaten in like 5 days a week, whatever it is, he's not going to be able to he's not going to be able to walk. We bring that up to the nurses, and the nurses bring it up to the doctors, to the doctor, and the nurses give us kickback at first. To my understanding from the people I know that are nurses and the people that work in that industry, I mean, like, the nurses have a lot of influence on the doctors, and the doctors kind of have like basically like the last say ish. At least they want you to think that really you have the last say in many cases. It felt like everyone is ganging up on us, on me and my mom, and trying to not put a feeding tube in him. And they said it's because he couldn't swallow, which makes no sense. Like, there are people in hospitals that can't swallow all the time and have feeding tubes in them. And after my mom talks to some nurses, I talked to some nurses there, really what it came down to is no one felt comfortable doing it. And a lot of the nurses there didn't have experience doing it, period. Like, some of the nurses on that floor, they had only ever done it 2 times, and every single time they had done it, the patient could swallow. And they kept saying, well, we don't want him to throw up, and then the throw up gets in his lungs, that causes this infection or that infection. And I get that. But once again, I really genuinely feel like it wasn't that big of a deal, which leads me to like the first nurse that came on night shift, ironically. She had also only done feeding tubes twice. But one of the times that she did do a feeding tube was the exact same situation my dad was in. So she was like, yeah, dude, like, as long as I get the go ahead, let's do it. I'm like, oh, thank you, Lord. Like, thank you. But she was the only person, the only nurse there, the only person that was willing to try. Everyone else was super reluctant. They kept going to the doctor. The doctor says it's not recommended. I'm like, I don't care, dude. Like, I'm not stupid. Like, you can literally You can look this stuff up online. And then they wanted to like do a peg, which is like when you shove it into their side. And I'm like, no, man. Like, are you guys like, what is going on with your head? Like, he is going to pull that out. Like, he doesn't understand why there's a tube sticking out of his side. The part that worked out the best is they have like these boxing mitts kind of that prevent you, they prevent you from like grabbing onto things. And once we put those on my dad, like everything was good. Everything was really good. We kept pushing and pushing and pushing for the feeding tube. Finally, I said, fine, if you want to do it, we'll do it. And we did it, worked out fine. My dad got food for like the next 6 days. He actually gained weight at one point, which is great. But that was the first thing where I was like, wow, this is crazy. You just went from like, you know, saying my dad should just go home and die to, okay, let's put a feeding tube in. We just kept having incident after incident that just really grinded my gears, dude. And I don't mean to like just be a complainer, but I'm saying all this to make a point to all of you that if you have a family member in the hospital, do not leave them there by themselves. If they can't make any reasonable, actually, even if they can make decisions, like help them work through those decisions and still advocate for them, because they will be taken advantage of. Okay, one instance would be, once again, his feeding tube, right? My dad kept having like a lot of oil just build up on his nose, and it would loosen up the tape that holds the feeding tube in. And I myself would remove the tape partially and then retape it on and jerry rig it kind of back to his nose myself. Like they left tape by the bedside for me to help. I was helping out any way I could, wiping his tush, you know, leaning him toward me, leading him away from me so they can clean him, changing things, moving him on the bed, rotating him. I mean, you name it. I tried to help those nurses out as much as I could because I figured if I made their lives easier, they would be more willing to work with me. And it did help. It really did help out a lot. I had to leave. There's some days I had to leave to come back and help my wife out with some things. And during those days I was gone, those were the days that things like kind of fell apart. So the first issue that happened was with the feeding tube. So there was one night where my mom noticed that the tape on the feeding tube was about 2 to 3 inches down from where it had originally been connected to his nose. I told her not to worry, let the nurses know. Nurses came in, they said they had to take an image, right? They're doing all like the normal protocol. Makes total sense. Everything's good because they want to make sure it didn't like slip out all the way out. And I told my mom, once it is determined that the tube is still in the stomach, tell the nurses that they need to shove it deeper into his stomach. Because common sense would say that if the tube has slipped out 3 inches, that's a good amount of length, you know? And if by somehow it is still in the stomach, if he tugs on it or he moves too much and it slides down, the tube is it runs a further risk of coming out. Obviously, if that's far enough out for you to take an x-ray of his stomach or whatever again, you know, like, dude, like if it's that serious, why would you not put it in deeper, right? Like next day they find out, yeah, tube is good. It's just, I read the report. It said it was just basically the feeding tube is barely inside the stomach past the esophagus, like connection point. And that he's still good to feed. Mom told them like, hey, put the feeding tube deeper into his stomach. Doctor said, no, he's good. We're just going to leave it. Everything's fine. Literally less than like 5-6 hours. I was coming that night. I was actually coming back that night. And I told her, I'm like, dude, I'm just going to shove it in myself. I'm going to undo the tape, put it in. Like these guys are so lazy, you know, they can't just undo a little bit of tape, you know. Before I got there that night, literally like 2 hours before, he had pulled it out. This is another thing I take issue with. Supposedly, I'm not going to say supposedly. The nurse did do this. This is not the nurse's fault. It's the doctor's fault. Once again, another reason why I don't trust doctors anymore, right? I do not trust them at all with the care of any of my family members. Trust nurses, fine. The nurse relayed that information to the doctor, right? I would assume common sense that if someone pulls out their feeding tube, you might want to let speech therapy or whoever it is come in, like let them know, like, hey, this person is now without a feeding tube. We need to do a swallow evaluation or whatever it is, and see if they can eat and drink on their own now. Because he should be moved up the list because he doesn't have anything to feed him right now. Obviously, right? He's still getting IV, so he's getting liquids, but no actual calories. So I would think that, right? So I get there that night and I ask the nurses, I'm like, hey, is speech therapy coming in today? They said sometimes they come really late, but we don't know. You might see them tonight. Night passes, they're not there. The next day, hey, is speech therapy coming in today? Oh, we don't really know. They're making the rounds. There's only like so many people that do this. We'll see when they get here, right? Whole day passes, no one comes. So that actually technically the feeding tube didn't come. I'm sorry, feeding tube came out around noon, so not a few hours before I got there. It was like, I mean, it was like more like 6 hours before I got there. But so my dad, by the time that day ends, I mean, that you're closing in on 2 days without food, right? Ish. So the next day, whole day passes, speech therapy is still not there. And this is when we run into two issues at the exact same time. One, my mom is furious at this point because speech therapy has still not come. She's furious, flaming, which rightfully so. That's her husband, and I am very upset as well. I'm more so. I'm less like emotionally upset and more like, help me to understand why they're not here. Like, let's get to the bottom of this, you know? So the charge nurse of that night comes in because obviously she knows that my mom's irate. I don't know if irate's the right word. Sorry if I misspoke there, but she's going crazy, right? And I tell my mom, like, hey mom, just let me handle it because we don't want to, like, I'm trying to make it clear to her, like, we don't want the nurses to turn against us. Obviously the doctors don't care about us at all. Like, they're trying to do the bare minimum, you know, amount of work here. I asked the charge nurse, I'm like, okay, so let me just understand this. You know, like, his feeding tube came out Sunday. And she's like, yes. And I'm like, and the nurse that day informed the doctor that the feeding tube came out. She's like, yes. I'm like, and then the doctor did put in a request for speech therapy to come in for a reevaluation? Question mark? And she's like, well, and she's trying to cover for the doctor now. What was it she said? So she said, well, he already did days before this happened. And I'm like, what do you mean by that? And she's like, well, when your dad first got checked in, he was met by speech therapy. And then after that, he was already on the speech therapist list for the speech therapist to, like, come back and, like, do his rotation and check in on him sometime. And I was like, so he didn't put in a request for speech therapy to come in and see if my dad could eat and drink. Is that what I'm hearing? And she was like, yeah, no. Like I said, and I'm like, no. No. Okay, so here's what we need to do. I need you, please, tell the doctor my dad has been without food for several days now, and I need you all to understand that when he loses even a couple pounds with Alzheimer's patients, sometimes that takes 4 or 5 months to gain a couple pounds. So the longer he's in here without eating, the longer his recovery process is going to be. If we can even get him back, right? Sometimes it's just not possible, you know? My mom had to work tirelessly day and night for like 6 months for him to gain 10 pounds. And that is with her, not some random worker that just has timed meals and timed snacks. No, her basically shoving food down his throat all day, every day for 6 months, you know? So I'm just like, kind of like, I'm like, bro, like this is ridiculous. So it just astonishes me that this doctor is like, yeah, we'll get to him when we get to him. He doesn't need food. He'll be fine a couple days without food. I'm like, it doesn't make any sense to me. So that really messed me up. Just because like that's my dad, dude. Which, by the way, once again, so at this point, my dad is starting to regain more consciousness, and he's starting to like talk more and interact more. He's still sleeping most of the day, but you know, if we say like "I love you, Dad," like you know, he'll say like "I love you too," you know, like he'll look at me and my mom and say that, you know, and he might not know who we are, but you know, like he still appreciates like the compassion, you know. So like that happened. Thank you, nurses, for listening to us and taking care of that. That night we got another new nurse. What had happened before she got on shift, and I didn't really fully realize it. I thought something was off, but I didn't know. My dad had kind of sort of kicked out his catheter. Like you can't really kick out a catheter because there's a balloon on the end, and so it prevents it from like moving. But he damaged his junk enough for blood to be present. And you know, when I'm moving things around, I'm checking everything all the time. Like, dude, like you just got to do it, man. Like whatever. So I'm checking everything. I noticed a little bit of blood, but then as all of this dialogue is going on toward the end of it, as we're concluding on what to do next, then I get down to the catheter part. I notice a pool of blood and urine underneath my dad. I bring in the nurse. I'm like, hey, we think he pulled out his catheter. Can you come check this out? I ask her if we can move to a like external type catheter. I'm trying to have this conversation with her, and at first like it's kind of like I'm hitting a wall, and I'm like, dude, why am I getting like so much resistance here? And then I'm like, okay, duh, she hasn't actually seen what I've seen. So I lift up his gown. I'm like, see, this is why I'm thinking he might need something new, right? He had like blood everywhere. She was like, oh, yeah, that we could maybe re-talk about this now, you know? From there, we get the charge nurse to come back in, and she sees the situation. She gets the nurse practitioner to come back in. She sees the situation, and then she goes and talks to the doctor. And we're like kind of getting hopeful here, thinking like, oh, this is great. He's going to get his catheter out. We're going to see if he can pee, right? Because common sense, once again, would say like, why not see if he can pee on his own now? You know, he never had issues peeing before. It was kind of more of so just I think they really just put that in there as like a convenience thing. So the nurse practitioner comes in, and guess what? The doctor says, yeah, we're going to pull the catheter out, but we're going to put a bigger one back in. So I look at the nurse practitioner like, I have an idea. Okay, hold up. Before we do that, I'm just trying to use common sense here. I'm not a medical professional or anything, but, you know, in your professional opinion, if we were to take the catheter out and put a diaper on him, what's the harm in just seeing if he goes potty by himself? You know, like, I mean, what's the harm in seeing if he can just go pee, you know? And the look in her face was like, well, yes, but, you know, this is what the doctor has recommended. I'm like, yeah, but like, you know, like, let's just try to use some common sense here, you know, like, what would be the harm in seeing if he's able to pee on his own? Because that was like their big concern. It's like, well, we don't want his bladder to blow up and like all this stuff. But I'm thinking like, dude, like, why do you think his bladder is going to blow up? You know, like, why do you think that? He hasn't been on any real medication, like sedatives, really. Just lots of antibiotics at this point. And like Tylenol. And she like came, she's like, well, if that's what you want to do, I'm like, yeah, that's what I want to do. Yeah, that's definitely what I want. And even my nurse, who, you know, I made friends with before the nurse practitioner came back in, she actually had my back. She was like, yeah, see, like, look at all this, like, it's all blood, and look under here, he's like bleeding all over the bed. Like, maybe there's a chance, you know. She's just straight up said, like, I don't feel comfortable putting in a larger catheter on this guy. They remove the catheter, and what do you know? He literally starts going to the bathroom like right away. Everything's working fine. So, point being, my dad is doing much better now. He's actually eating, he's drinking, he's making a tremendous recovery. It's just very frustrating for me. I don't really understand why things or how things got to the way they did. I don't really understand why our doctors, I mean, my dad's been there for a week and a half, and our doctors, there's multiple that take over and switch patients, whatever. They've seen him collectively like a total of 15 minutes. Maybe honestly, that's generous. That's generous. That really is. I would say probably realistically more like 8 to 10 minutes. Like there was one time we held one doctor up for like maybe 3 or 4 minutes with questions, but he was like very eager to get out of there. But I can tell you with absolute confidence right now that if me and my mom were not there for my dad in that hospital to advocate for him, he'd be dead, or he'd be on his deathbed right now. He would not have gotten the level of care he needed. He would have gotten the absolute bare minimum of what they think they could have gotten away with. And I'm not saying it's the nurses' faults. I put full blame on the doctor, all the doctors at that hospital. I think they are a combination of lazy, lacking empathy, or lacking all types of bedside care manners, whatever. And I think that they just view people as names on a door frame. I think I definitely had like a level of naiveness or naivete or whatever you want to say around this topic, because I had never really had to take care of a family member in a hospital before to like see what happens behind the scenes. Even though I have tons of friends that are nurses, tons of family members that are nurses. And I can tell you right now, I know all those people I know are hard workers and they're good. Were things done to him ethically? Yeah. It's sad that if this happened to my dad, I can't imagine how many other people this happens to every single day that it just doesn't get noticed because their families aren't there, you know? So, yeah, just don't let your family member be in the hospital alone. Love you guys. Do good, be good.